Dr. Olusola, thank you for joining us here on Health Connection again. Our topic is colorectal cancer. It's something about which people are prone to procrastinate. Only, as it says here, procrastination can be deadly. Right. Let's get a definition. We like to do that in Health Connection segments. What is colorectal cancer?
Well, thank you for having me again. Well, the colon is also called the large intestine. It's about 5 feet long. The last 6 inches of it is called the rectum. Cancer developing in the colon or the rectum is therefore called colorectal cancer.
Okay. And how common is it and how serious is it?
Well, colorectal cancer is the second leading cause of cancer death in men and women in the United States. It's the third most common cancer, but it's the second leading cause of cancer death in men and women in the United States, behind lung cancer.
What causes colorectal cancer to develop in some people and not in others?
Okay. I get that question quite often, and my initial response is usually, you're old enough. Really with a tongue in cheek. And the reason I say that is that about 80% of individuals who get colon cancer are usually over the age of 55. So the most important, what we would call risk factor for colon cancer is age. The next most important thing is family history of colon cancer. If you have a family history of colon cancer, then you have a higher risk of developing colon cancer. But again, most people who get colon cancer do not have a family history of colon cancer. The other things that have been shown to increase the risk of colon cancer include Western diet, particularly diet that is rich in red meat, being overweight, alcohol, and smoking are the other things that have been associated with the development of colorectal cancer.
What are the symptoms of colorectal cancer?
Usually, most people who actually have colorectal cancer initially do not have any symptoms. By the time individuals get symptoms, it's usually a sign of a relatively more advanced disease. Common symptoms, however, will include things like bleeding, abdominal pain, and sometimes you could even have a bowel obstruction from colorectal cancer. And some people can even have some weight loss from it if it's quite advanced.
Most of us know that the way colorectal cancer is detected is through the colonoscopy, which people don't look forward to. How important is that test?
Well, colonoscopy is very important in the diagnosis of colorectal cancer. Most people who get colorectal cancer usually tend to have what are called polyps. Polyps are growths in the colon, which, if not removed, eventually can grow and turn into colon cancer. Colonoscopy affords us an opportunity to remove those polyps so that they don't continue to grow and turn into cancer. The other big advantage of colonoscopy is that it gives us an opportunity to find cancer at a very early age. The earlier cancer, any cancer for that matter, the earlier they're detected, the better the chances of therapy.
So if we do have a diagnosis of colorectal cancer, how do we treat it?
Well, if the treatment could be as simple as just having a polyp that had cancer in it, remove that colonoscopy, and that may be all that is needed. That's called removal of a malignant polyp. I wish all cases were like that, but that's usually not the case. A lot of cases present at a later stage, in which case an operation is needed. Just like any cancer, the goal is to remove the tumor as much as is possible, and actually to remove the entire tumor. So most people, therefore, with colorectal cancer, because they tend to present at a later stage, will need some form of operation. In addition to surgery, there's a role for chemotherapy, and there's some role for radiation therapy. It all depends on the stage of diagnosis.
With respect to diagnosis, apart from colonoscopy, are there other screening tests with respect to colorectal cancer?
There's what is called a sigmoidoscopy, which involves just looking about a third or less than 50% of the colon. We've talked about colonoscopy already, which involves looking at the entire colon, and that's the preferred test recommended by most of the societies, particularly the American College of Gastroenterology. Other than colonoscopy, however, there are other tests that are available for what we call colorectal cancer screening. The very common ones are tests that is done to look for microscopic, or what we call occult blood, or just blood that is too small for us to see with our eyes. That's a test that just looks for blood in the stool. The best of those tests is what is called the FIT, F-I-T, also known as the fecal immunochemical test. This is a test that looks for blood in the stool. The problem, however, with this test is that it's not a very good test to find polyps, and we just said that most cancers develop from polyps. In addition to that, the fact that your FIT test or your stool test is negative for blood does not mean that you don't have cancer. Finally, even if your stool test is positive for blood, you will still have to go get a colonoscopy to see really what's going on in the colon. The FIT test, therefore, is very commonly used in Europe. It is not frequently used in the United States because we can directly go to a colonoscopy and answer all the questions in one test. And before I finish, there's also what is called virtual colonoscopy or CT colography. This is basically a CAT scan that looks at the colon, and then the images are there and they are viewed by radiologists to then see whether there's a polyp or cancer in the colon. Again, just like the FIT, virtual colonoscopy or CT colography, I get that all the time when patients say, can I just do that virtual colonoscopy? It is available as a choice for colon cancer screening. However, if a polyp is identified or a tumor is identified or anything is identified in the colon, you will have to drink another cleaning solution again and then come back to a colonoscopy to remove or biopsy or take any further action. So it's just another test that involves cleaning the colon, and then and then you have to come back to a colonoscopy if that test is abnormal. That's why it's not very commonly used. And finally, about 2-3 weeks ago, the FDA in the United States approved a capsule for evaluation of the colon called the pill cam. This is a capsule about the size of a big vitamin pill, and it has a camera on both sides of it. And this capsule is being used in Europe, but just got an approval in the United States. It is currently approved to evaluate the colon when colonoscopy has been incomplete. So in situations in which, for whatever reason, the entire colon could not be evaluated with a colonoscopy, then that pill cam is available to be swallowed. You swallow the pill, you still have to clean the colon out, then you swallow the pill and you wear a recorder. And as the pill goes through the intestine, it takes pictures, it sends it to the recorder, and we can then watch that video on a screen after the study has been completed.
Oh, very well. Are there things we can do now to reduce our likelihood of getting colorectal cancer in the future?
Yeah. The most important thing you can do is really, if you're in the right age group, if you're 50 years and older, to get a colonoscopy. That's the most important thing you can do. If you have a family history, then colonoscopy may be needed earlier than the age of 50. I would recommend that you talk to your regular doctor or to see a gastroenterologist so they can tell you when to start getting your colon checked if you have a family history of colon cancer. Finally, just like I said earlier, there are other things that have been associated or what we call risk factors for colon cancer, including obesity. So I would recommend that people lose weight. Stop smoking if it's possible, because smoking has been associated with colon cancer. And then alcohol has also been associated with colon cancer. That trying to reduce or stopping alcohol consumption is also important. And changing the diet, particularly reducing red meat and other forms of processed food in the diet will go a long way to reduce the risk of developing colorectal cancer.
2 questions I'll bet you get a lot. 1, is colonoscopy painful? And 2, will there ever come a day when you don't have to drink that solution that cleans out the colon?
That's right. Those are the 2 most common questions that I get. Number 1, colonoscopy is not painful. Now colonoscopy all around the country is performed with some form of sedation or some form of anesthesia, so there should really be no pain involved with doing the colonoscopy. The next question is the question of drinking the nasty tasting things to clean the colon. I will usually say that time is now. We're gradually moving away from the big gallon that we used to give people all the time to clean the colon out. We now have different types of smaller volume, more pleasantly tasting liquids that people can take. And we also have pills that are available that can be used to clean the colon out. So now than ever before, we have several choices of things that we can give to clean the colon out ahead of a colonoscopy.
You've covered this several times in this discussion, but let's put an underline under it. At what age is colonoscopy and screening for colorectal cancer appropriate?
Yes. Well, in the United States, the age we use is 50. And just like the reason that 50 number was picked is because I talked to you earlier, the most important risk factor for colon cancer is age. Most 80% of colon cancer developing over the age of 55. That's why we like to screen at the age of 50 so we can find polyps before those polyps turn into cancer. So in the United States, the age we use is 50 as for what we call average risk individuals, which are individuals who have no family history of colon cancer. There is some data that suggests that African Americans, because they have a slightly higher risk of developing colon cancer at an earlier age, and because they have a risk of developing a more aggressive form of colorectal cancer, there's some data that says that African Americans should probably start earlier than the age of 50. It's a little controversial if we go early when that should be, but one of the data out there suggests maybe starting in African Americans at the age of 45, and then starting everybody else at the age of 50. Now, if you do have a family history of colon cancer, then the age of starting colorectal cancer screening depends on who in your family has colorectal cancer and what age the family member has colorectal cancer. And that gets a little more complicated. I will usually recommend that those individuals be referred to us so we can talk to them about their family history and tell them when they should start screening for colorectal cancer. Everything we've talked about is colorectal cancer screening. However, if you're having any symptoms of bleeding or pain, you may need colonoscopy done sooner. That's considered what we call diagnostic colonoscopy. That's not based on age, that's based on symptoms. Colorectal cancer screening, however, is in individuals who have no symptoms as just a routine health check.
Very well. Doctor, very interesting, and thank you very much for your time.
You're welcome. Thank you.